Does your organization have a board-level quality committee and/or clinical quality committee? If yes, how does that committee fit into the board reporting structure? Does your organization have a strategic quality improvement plan with clear goals for improvement that uses data and benchmarks? What are your hospital or health system's current methods for monitoring quality and patient harm? And are quality measures and harm events reported to the board?
The role of the board is to understand the fundamental philosophy of the organization, the purpose of its being in existence at all, and defining who it serves. In all things it does, quality is a measure of its success.
I think that boards really need to understand that they have a role to play in quality, whether they have a clinical background or not. I've seen a real melding of the roles of quality among everyone at the table, because I believe that our board in particular understands that their role now is much broader than just making sure that we're financially sound and that we're providing services in the community, that quality is job number one for them and that they are ultimately responsible for it.
The role of the board is critical for quality. Unless your board is committed, the difficult decisions that need to be made on a day-to-day basis won't get made. Our board is really our strongest connection with the community. And we know that those discussions regarding quality take place not just around the board table and not within the facilities, but in the communities in general. So we need our boards to engage, we need our boards to own that, and we need our boards to have our support when we make difficult decisions to support quality in our institution.
Boards are responsible for overseeing, as a fiduciary, quality performance as well as financial performance. And they need a set of high-level metrics to do that. Again, oftentimes we give them the data we use to manage, but boards need to identify those key elements of quality that are important to them. Many of our boards are self-perpetuating boards, meaning they get to select their members. And they need to look around the table and see if they have the expertise in quality and safety to really excel in this area. Additionally, they get to appoint, monitor, mentor, and incent the leadership of the organization, the CEO. So as they do make those decisions, they have to select and mentor and incent on quality-related activities and on the philosophy of the CEO to be patient-centric, be patient-driven, and to aspire to high quality. Boards control the purse strings. They make all the allocations. So when they're considering budgets or they're considering new programs and services, they need to ask the quality and safety questions. How does this change our organization? What risk are we introducing in the organization? How are we mitigating those risks? How are we assuring that the service is delivering the kind of quality we need to look at? So boards, in determining any new service or product, have to look at not only the financial return on investment, but what is the quality return on investment? Boards should also have written work plans that describes their goals for quality and safety for the organization yearly and describes how the board will engage in helping the organization achieve those goals. Every board today should have a quality oversight committee. That committee should be made up of board members, patient safety experts, quality experts, and other community members to help guide the organization and set the organizational quality and safety goals. Boards have an important role to play in the strategic planning process. The board represents the voice of the community and the patient, and that perspective is sorely needed as we design our services to meet the needs of that population. Boards should be asking questions about what are the real needs of this community and how can our services satisfy those needs? How do we design our services so they are accessible by the community and improve the health of the community?
Quality is our mission statement. It's the center of our mission at Silver Cross. And it's also then bolstered by being one of our 6 primary strategic initiatives or objectives. So that's how we continue to keep quality and safety on the radar screen and continue to focus our board work on making sure that quality is not only a mission objective, but that we have a strategic platform or plan to accomplish our goals.
In looking at the overall strategic plan, boards must assure that quality is weaved through the plan. Since harm is a necessary condition for quality, boards should ensure that harm measures are also considered in monitoring the plan and making sure that reduction of harm is one of the overall goals for the plan.
And the board must be accountable for mistakes. Therefore, one of its fundamental objectives would be to understand quality processes, understand quality of care, and make sure that the resources are put in place and systems to hold people accountable are put in place to guarantee quality every time.
I think that what we're seeing in terms of board work today is a shift in the balance of where boards are spending their time. Traditionally, boards spent more focus and more energy, and because they were more comfortable and had backgrounds in business and finance, on the financial health of the organization. What we're seeing now is the board spending additional time on quality and safety oversight because of the important role it's going to be playing in the future as more of our payment is based on quality, and because it's what our community needs and should expect. So I think that boards should expect to spend more time on quality at their meetings and in their committee meetings.
Boards should have written, well-defined leadership and oversight responsibilities for quality. Goals for eliminating patient harm and improving quality need to be embedded into the strategic plan and planning process. Boards should spend significant and meaningful time and energy discussing quality.